from the admission procedure to the learning and teaching culture at Amrita Vishwa Vidyapeetham. Our esteemed panelist will talk about what makes Amrita Vishwa Vidyapeetham more than just a university for higher education. Joining us today are Dr. A.K. Mandal, HOD of Allied Health Science and Pathology, Dr. Saha, HOD of Biochemistry and Coordinator of Medical Education Unit, Dr. Jit Adhikari, Consultant and Faculty of Allied Health Science and HOD of Physician Associate Program, Dr. Praveen Bisht, CIO, Dr. Lekha Vishwanath, Principal of Nursing. Let's start with talking about the teaching philosophy of Amrita Vishwa Vidyapeetham.
Sure, thank you. I think in terms of philosophy, we always believe and are committed towards complete holistic development of a student. So, as a university, we not only focus on education for living, which essentially allows a student to earn his living, but also education for life, which makes him a better individual so that he can be a good citizen to the society. So we can say education for living and education for giving back to the society. When it comes to research, our philosophy has always been that education should be tied down where it is applicable to the day-to-day problems of an individual. So unless and until the research is applicable to the society, we don't believe in just doing for the sake of research and putting the research back in the a drawing board. It has to be applicable to the society. So we are very, very focused on what topics of research we undertake.
So what is the admission procedure of Allied Health Science courses in this institution?
Well, the admission procedure is for Amrita. We have our entrance exam. To appear the entrance exam, a student should have 60% marks, at least in the 12th standard. Along with the mandatory subject is physics, chemistry, biology and English. For two special courses like radio imaging technology and radiotherapy, students should have mathematics also. And for each subject, students should have 55% marks at least. So this is the criteria about allied health. I think Madam can speak about the nursing.
For the nursing and allied health, we have a common entrance examination, Amrita entrance examination for the life science. So when the students apply in the Amrita portal, they can give option. We have two campuses of health science in Kochi and Faridabad. So for the Kochi, Faridabad, nursing and any of the allied health program which they wish to choose. So allotment is, we have a centralized system of seat allotment. So students will be allotted the seat according to the rank they get. So as we said, we also have the same admission criteria, physics, chemistry, biology and English. The 60% mark is the cut-off mark. According to University Council, it is 45% mark.
What are the basic courses of Allied Health?
We have a nursing program already, and along with nursing, we have other BSc programs for allied, like cardiac perfusion technology, then cardiovascular technology, nutrition, intensive care technology, physician associate, respiratory therapy, then echocardiography, blood bank, radiotherapy, medical radiology and imaging technology. Then there is medical laboratory technology, then neuroelectrophysiology, emergency medicines, then operation theatre, dialysis technician and master of hospital administration. So each specialty have different seats, like on an average 10 to 15 for the each specialty, and for medical administration it is 25.
What is the teaching training program and how will
Here at Amrita, we have a unique system of teaching. In the sense that in the first year, the student is taught all different courses, anatomy, physiology, biochemistry. This is done in many other places also. But where our uniqueness comes is that there are certain subjects that we teach them which are extremely relevant, is not taught anywhere else. For example, communication skill. We feel that the student must be able to frankly and fluidly communicate with the patients, even when they go to the job profile. Same way, if they are going into research, which Dr. Praveen was saying, they must have biostatistical background. So we teach them the biostatistics. Of course, they should be proficient in English, so that is very much part of the courses. Then, if they are coming to medical line, they must know how waste disposal is maintained. So that is something we again teach them, waste disposal. We also teach them the different health programs that Government of India follow and our institute follows, and they go to the peripheral urban health center, rural health center, where they are taught all these things.
So we started nursing in Faridabad campus in 2022-23 academic year with 60 seats, and from the second batch onwards our seat is increased to 100. And we follow Indian Nursing Council curriculum, which is mandatory for all the nursing colleges of India to follow. And nursing curriculum as such is very systematic. It is a 4-year program divided into 8 semesters, in which the courses are organized systematically from basic to advanced, as I said, starting from anatomy, physiology, psychology, sociology. Then in the second semester they learn about the advanced foundation, biochemistry, nutrition, pathology, genetics, etc. So which will help them to prepare as a very competent professional to meet the complex need of the current healthcare system. And as such, the curriculum, we have the theory classes, laboratory learning experiences and clinical experience for the students will be posted in the clinical hospitals. And all the theory portions will be covered before they start the practicals. And they practice all the nursing skills in the laboratory so that they become confident before they actually take care of the patients in the clinical situation. And during the clinical posting, they are under the close supervision of the teachers, where they have specific learning requirements, learning assignments, which will make them the professional, the competent professional nurse.
How do you shape the future of nursing?
So when we started the nursing college at Amrita, we had our vision was providing high quality nursing education in a student-friendly atmosphere. We always feel that nursing education is very stressful. Unlike other professional courses, nursing students don't enjoy their life. Even some time back, I conducted a study on graduate nurses' perception of nursing education, where 80% students, graduates said nursing education is stressful, and 86% said it's burdening. So, this was in my mind when we started the college, and we tried to make provide nursing education in a student-friendly atmosphere, making all the learning experiences more interesting, so that learning will happen effortless. That is our vision. Learning will happen effortless.
What are the facilities you have in your institution that can help the students in their curriculum?
Thank you. In fact, if you really ask me, I will say for the curriculum, any curriculum to be successful in an institution, primarily we need 3 things. Number 1, faculty. Number 2, infrastructure. And number 3, hospital for patient care and management. Here in Amrita, we have senior and experienced faculty who have joined from AIMS New Delhi, from Maulana Azad Medical College New Delhi, from Lady Harding Medical College, from Vardhaman Mahavir Medical College, and also from Armed Forces Medical College. They are highly experienced and competent faculty members. So far as infrastructure is concerned, we have 4 air-conditioned lecture halls having the student seating capacity of 180 each and fitted with all modern teaching learning gadgets. We have NABL accredited labs, biochemistry lab, pathology lab, molecular biology lab, microbiology lab, they are all NABL accredited. Our hospital, which is tertiary care hospital, having 2,600 beds, is also NABH accredited. So with all these infrastructure, this Amrita is really doing very well here in Delhi NCR.
So one more question. What do you think are the biggest challenges faced by teachers in the modern era?
Actually, if you ask me, the challenges faced in the modern era by the teachers, it is to keeping update with the latest technologies. That is one of the biggest challenge, because yesterday's good educational practices may become useless today, or say after 2 months or 3 months. So therefore, we have to keep updating ourselves every time through lifelong learning. That is why, in fact, teachers are also called lifelong learners. So we have to keep updating ourselves, and updating ourselves in the knowledge, in the skills, and apply this knowledge and skill in the teaching learning tools in day-to-day curriculum. That is number one challenge. And number two challenge, I will say that dealing with the mental health of the students. You will definitely agree with me, madam, if I say that these days the number of cases of depression and anxiety are increasing amongst the students. Every third day we hear that so-and-so has committed suicide. So more than educators, we have to act as counselors also. And the third challenge, I will say that because these days the parents are in fact very, very demanding, and we have to keep giving them the feedback through WhatsApp and email messages. So I think these are the main three challenges which we face. Thank you.
I completely agree with what Sir said. In addition to that, keeping the students engaged is also a big challenge, because the young generation, their needs, their background, their aptitude, interest, everything are different. And teachers will have to take a lot of effort in meeting the student needs and demand and keeping them positively engaged.
So how do you motivate your students to be a good professional?
Well, actually we have a mentor-mentee program we follow, and we believe and follow personalized interaction with the student. That will increase their positivity, they will be more professional in that. And we also follow small group of teaching. So that will give more importance to each student, and they will feel that we are also part of this journey and the institute. And we are trying to, we are having some specialized class in professionalism too for our students. So that is how our student will get more professional, I think.
Will the student get hands-on experience while they are undergoing the training process?
Yeah, of course, they will get a hands-on training, because anybody who is coming to allied health science or any of the paramedical or medical or nursing, whatever stream you talk about, without having a clinical experience, a clinical hands-on experience, a clinical demonstration, the training is incomplete. And that is our biggest asset. We have a huge backup bed strength, huge patient, huge infrastructure that has been explained to you by my predecessors, and that is where our students will really enjoy this course, and they will have a lifelong experience. Perhaps they will not get it anywhere else. The other thing I want to mention at this juncture is that they go into the specific stream for a hands-on demonstration and the clinical experience or the lab-oriented experience from second year onwards. So second year and third year, particularly in the internship, that is fourth year, where they will get huge amount of hands-on training and actual one-to-one experience of what we call. But that does not mean that in the first year they are not getting subject-specific hands-on experience, because one day we have kept for the subject where they go to the department, and they get hands-on experience.
Nursing education itself is practice oriented. They have practical experience distributed throughout the semesters. In the each semester, learning objectives will vary. For example, in the first semester, their learning objective is mainly the communication and learning about the vital signs. So when they come to the clinics, they will focus on these two skills. And in the second semester, they will start applying the nursing process. Actually, the essence of nursing is nursing process, where they assess the patient, do history collection, physical examination, review the patient report, doctor's notes, and identify the patient's nursing care needs, makes nursing diagnosis, then plans care, setting objectives and selecting interventions, implements care and evaluation. This is the actual nursing process they start learning from the second sem onwards. And in the third sem, fourth sem, fifth sem, they will be starting specialty nursing. In nursing, we have 5 specialty: adult health nursing, the pediatric nursing, obstetric and gynecological nursing, psychiatric nursing, and community health nursing. So in each specialty, they will apply the nursing process with a theoretical background. And we have a lot of practice-oriented assignments like the case study, care note, the health education. And they will actually provide care to the patients according to the need after their laboratory education and developing the nursing skill. And we make sure that the students develop the skill before they actually perform care for the patients. So throughout the period, they have hands-on training. And the last semester, that's the 8th semester, is completely internship, where the students will be posted in the clinical area.
Do the students get any exposure to research?
Yes, research is included in the curriculum. So they have a paper on research and statistics. So they have 45 hours of theory class, and they have to undertake a project which is individual under the guidance of the teacher. So the students develop beginning skill as a part of nursing, BS nursing program. In addition to that, they will be conducting multiple group projects, which is also research oriented.
Yes, of course, we train up the student for research, because this is essentially an orientation to research. At this young age, they cannot do a proper research. So we teach them biotechnology in the second semester, and we give them 2 projects, or we call as short research project, and we leave them in a group so that they can pursue this short research project under the guidance of a mentor or a faculty who guides them how the research is done, how the review literature is done, how the gap analysis is done, and then we train them up like that.
So do you have any feedback system to communicate with students and parents?
Actually, if you ask me, the feedback system in Amrita is the backbone. The main focus is on the feedback system. And the system also demands that. The feedback system here in Amrita, what we are following is 2-way communication. We take the feedback from students and we give them the feedback also. In fact, it is in the format of KPI, Key Performance Index, which includes points from all the aspects. That is, be it faculty, be it infrastructure, be it hospital care and management, be it administrative points, be it teaching learning activities, all points are included in this, and time to time we take feedback from the students on these points, and we improve upon our deficiencies. And also we have feedback system after each examination. We call students and have one-to-one interaction, face-to-face debriefing, and we evaluate what went wrong, what went right, and accordingly we act. And the third feedback part is the feedback to their parents. As I had earlier mentioned, that we give the parents the feedback in terms of attendance, in terms of their marks, how they are performing in the test. We all communicate with the parents from time to time through email and through WhatsApp.
Why would students choose Amrita Vishwa Vidyapeetham?
In In fact, madam is asking why should students choose Amrita, and I will counter the question saying that why should not students choose Amrita? When students are getting best of the infrastructure here, best of the faculty, best of the hospital, 2,600 NABH accredited hospital, such experienced faculty, and with all the modern gadgets, why should not student choose Amrita? Plus, as you must be aware that the NIRF ranking of Amrita Vishwa Vidyapeetham, that is Amrita University, is 7th in overall Indian universities, private plus government. And if I take the medical category, it is even better. We are 6th. The hospital is NABH accredited. All labs are NABL accredited. We have more than 100 collaborations with the international universities. Then UGC ranking, we are category number 1 university. With all these things, why students should not choose Amrita? I am really surprised. They will all come to Amrita.
Do you think there is a gap between what the students are being taught and what the environment expects out of them after completing the course?
Because until we know the gap, we won't be able to improve and develop on it. So it is a very important step that as the institute, as a department, we must know the gap. The question is, how do you analyze the gap? Which is the source of your gap? One, of course, is the student feedback, which says that this lecture was not good enough, or this it is a problem, or this I couldn't understand. That is one feedback which comes to help us in gap analysis. But what is more important in gap analysis is market demand. Because everything is driven by a market demand, and we have to know what is the market demand. What are they asking? Which kind of, is it that they are asking more of molecular technology? We shift to molecular technology, we add the molecular technology. Is it that they are asking of more of genomic analysis? We have to shift our thing towards the genomic analysis. So the way we do market analysis is by calling speakers from big hospitals, from corporate world, and they talk about what is their development. We have a seminar system, we have a ground round system through which we know what is happening in the world. Then we have our own in-house seminar, in-house conferences through which we know what is happening in the world scenario. And then sometimes we do a mid-course correction. We often change the mid-course and we add certain subject or tweak certain subject to make them up to date. And so that they should be tomorrow, when they face the world, they should be able to deal with any kind of cutting edge technology. That is our main aim and motto, to produce a product for which not only we will be proud of, but even the students will be proud of.
Theory-practice gap and practice-theory gap has been a topic of discussion for decades in nursing. My personal experience, I would say, when I was a student, what I learned in textbook was really exciting, and what is happening in the hospital, the role of nurse, was not promising. And because market, as I said, market demand was less at that time. But in the last 1 or 2 decades, there is a movement towards healthcare quality, and nursing has become more demanding, whereas many graduates are not meeting the demands of the healthcare system. So again, there is a practice education gap. So when we started the nursing college in Amrita, or when we started the hospital at Amrita Faridabad, we had a vision to reduce the theory practice gap. So we have implemented a collaborative model of nursing education, whereas the service side and the faculty work together. And it is happening only in 1 or 2 other institutes in the country. So I have a dual role as a principal of a nursing college and deputy director of nursing service. So that makes the collaboration very easy. And we will be implementing all the procedures the same way it is taught in the college. and the practice also will be standardized so that the theory practice gap is minimized. So that is a unique feature of nursing in Amrita.
So coming to AI, it has a huge potential. So how far have we come and how much have we progressed in this regard?
Yeah, so AI is definitely a buzzword these days. You will see every single individual, be it a student or a professional, everybody talks about AI. And actually, it is a very universal thing because it can impact and if implemented correctly, it can definitely enhance any kind of service, be it a patient service in case of healthcare or it could be any other financial service for that matter. So that being said, the initial implementation of AI was more to do with RPA, robotic process automation, where the various functions of an organization was taken and tried to automate, try to make it more efficient. And then in terms of what the future is totally limited by our own thinking, because AI can do a lot of things. And futuristically, we are also talking about AGI, artificial general intelligence, which is definitely much more powerful, efficient, and it can really impact pretty much. I would say 50% of the job globally. That's what the IMF, International Monetary Fund, they have reported that.
What are some of the key fields where we will be seeing the most impact of AI in healthcare and in the future?
So when it comes to application of AI in healthcare specifically, so far we have seen that it has limited towards clinical decision support system, CDSS. Say for example, we have an MRI image of a patient, and for a radiologist to read that image is one thing, but AI can do it much faster because of the image processing technology that has advanced. So it can aid a radiologist. Similarly, when it comes to say pathology, digital pathology, it can look at a slide, come up with the analysis, and then present it back to the pathology. So similarly, it is currently working as a good assistant, and it is helping in clinical decision support system. But when it comes to the future, future again is very bright. We talk about predictive medicine. We talk about also personalized medicine and also population health. So these are the 3 P's we talk about. So from predictive medicine perspective, AI will be able to help look at the complete electronic medical record of the patient and then be able to predict what is going to happen much ahead of time. So you don't wait till the very last minute to realize that the patient is suffering from a disease. Instead, you will have with good probability, we'll be able to predict that this patient is likely to have this problem. So that is on the predictive part. When it comes to personalized medication, again the treatment option can be personalized to a single patient, and that can be done by looking at the different parameters. Because in today's age, we have all these devices. They are generating so much data, and it's humanly impossible for a doctor to look at all these parameters and then be able to suggest what the treatment should be. But AI is able to look at all the parameters holistically, also compare how those parameters were in the historical data, how it has transformed, how it has affected the patient, and with all that it can personalize the treatment option for a patient. And thirdly, the population health is more to do with policy making across a bigger population. So I think in all these areas, AI will be able to have a significant impact.
So what are some of the advantages of using AI in healthcare?
Again, very good question. So AI, as we all know, is finally a machine, right? And a machine like computers is fairly accurate, fairly precise. So from that standpoint, it is used for robotic surgeries. You don't want hands to shake while a surgery is happening. So as simple as that. Then I talked about image processing. So if a human has to read different images, there is fatigue that builds into the human body. But for computers, there is no fatigue. They could perform the same thing repetitively any number of times without having any fatigue. There is no question of optical illusion. Humans, again, if we look at something, after some time we have, there are so many cases where we have optical illusion. There is no problem with that for the computer. They can do image recognition perfectly again and again every single time. So there are all these advantages AI can help with. And finally, it will finally boil down to the effectiveness of it and the cost of it. So I think with the advent of time, it will improve both the effectiveness and it will reduce the cost of delivery.
To conclude the panel, I just want to ask one question: that what are the job opportunities after completing courses?
So everybody can speak. So from the job opportunity perspective, like I was mentioning earlier, that AI is definitely a buzzword, but for the right reasons. Just like we have seen tremendous change in the technology, and last 2 years have been, computer science has been the forefront when it comes to job market. The next 2 decades I can see is going to be driven by AI, and so I can see that any student who will decide to take this course will have a very bright future. And not only from the job perspective, but also research perspective, because if you want to go for higher education, this will be tremendous value. And finally, if you have your own startup idea, you have entrepreneurial skills, you could use that also. So from all these 3 perspectives, I think AI has a very bright future.
So, well, in one word, I can say after completing the course, sky will be the limit for them. Why I am telling? Because nowadays the job demand is very high in the market. There are in number of corporate hospitals in surrounding of us, and there are all private hospitals. So once they will complete, they will have a job facilities in this corporate hospital as well as in private hospitals. Then they can work in the nursing homes. Then there will be option for research and training institute for them. They can have the job opportunities in government sectors also, community sectors. So I can, in one word again, I will say sky is the limit, and more important, they can do higher studies. After completing BSc, they can go for masters, then PhD, then research. They can move to abroad. You cannot imagine how demanding nowadays for this allied and nursing and all the medical facilities. So that's it from my side. Thank you.
So we have been discussing about the global shortage of nurses. So the job opportunities of nursing is really limitless. We have opportunities in India as well as abroad. In abroad, you have to undergo the process for each country to secure a job, which is very easy now. Now the different countries are investing in recruiting. Without much expense also they can move abroad. In India also they have a lot of opportunities. So BSc Nursing is an entry-level program, and we have a diploma-level program is also general nursing program. At the graduate level, we have BSc Nursing program and the post-basic BSc. Those who have completed diploma can do a 2-year post-basic degree program to be a graduate nurse. And after graduation, they can go for specializations in nursing. We have 5 specializations: medical, surgical, community health nursing, psychiatry, and things. So after specialization, they can either work as a clinical nurse specialist in the hospital, or they can become a faculty. And MS Nursing program is research oriented. They can become a researcher also. And we have a lot of opportunities in the government setup. New government hospitals are coming up with good packages. They have a lot of opportunities. Then the post of community health nursing officers, where they will bridge the gap between the patients and the doctors. Then we have nurse practitioner program, but independent nurse practitioner is happening, especially in critical care nursing, midwifery practice, psychiatric nursing practitioner. That is also a good challenging opportunity for the competent people. And for the competent nurses, the opportunities are limitless, and we need nurses in India, and the world needs nurses in all levels.
So, any final thoughts from?
So here at Amrita campus, so we have, like everybody was mentioning, we have a huge healthcare facility, very state-of-the-art infrastructure. So the whole idea of also starting the AI course, BTech and MTech, is to work with the hospital in tandem. So we will have not only teaching the basics of AI data sciences, but also ensure that it is going to be more project-based learning. So we'll be working with our medical fraternity. We have excellent infrastructure, and we'll take their guidance, and we'll ensure that the research or the project that we work are on the medical field. But elsewise, if you, as a student, if you are interested in other domains, we will have those facilities also. But being in the same campus as the hospital provides us an excellent opportunity to work in medical applications.
Okay, so looking forward, I would like to appeal from this session that to the community, please come forward, come over here and see have your personal experience about the infrastructure, about our hospital. It is an international level hospital, it's the largest one in Asia. With excellent faculties as we discussed earlier. So I'm sure if you come over here, if you see by your own experience, and if you go through our campus, I don't think nobody will go to any other university or any other colleges. So for sure, on behalf of Amrita Hospital and Amrita family, I would like to invite you people to come forward and come over here and see and have the experience. Thank you.
Actually, if you permit me to say that, you should come here in Amrita and see yourself. If I say something, you will not believe. Actually, we have excellent faculty members here, excellent infrastructure, excellent hospital. But again, I am saying, I am requesting you, I am inviting you to come and see here all these facilities and then decide where to go. Thank you.
See, no healthcare facility can be complete without paramedicals, without nursing, in fact, even without AI. Because tomorrow, the equipment will be heavily based on AI. We need it. And not only we need it, not only there is a big gap, there is a big deficiency in our country. We have to fill that deficiency, and who can fill that deficiency other than Amrita, which has such a brilliant infrastructure and such a brilliant environment for study. We must feel the pulse and aim Amrita Institute, and future, I think, lies here. Thank you.
I feel the implementation of the curriculum happens in all the good colleges. But what makes Amrita would be the additional experiences that our students get. Being part of a large organization, different disciplines, but they are getting, they are able to see many role models apart from their own teachers. And how the knowledgeable people at the same time being very humble, I would say that is unique in Amrita. And the values we don't need to teach. They will observe and learn their own. And a lot of activities that we have. For example, I would say last year we had a seed ball campaign where we made seed balls. Students were also participating. They went for depositing seed balls in different places, so that sense of sustainability is greater to them. Last year, they also got opportunity to participate in C20 event. We had host an integrated holistic health summit where the students volunteered. They could listen to expert talks. So I would say this additional experience in all dimensions makes Amrita unique.
Good morning, Mr. Singh. So we'll start with, when was the college started?
The first batch of MBBS students arrived in August 2023. Although we got permission to start the college in March 23 from National Medical College.
And how many students are admitted?
150 students is our intake, and last year I'm happy to say we got all 150 for the college. Its very first attempt with all 150 was very nice.
That's great. And what is the admission process?
Well, the students give the NEET entrance exam, as you're aware, and once the NEET results come out, they have to fill out their choices for medical college, which colleges they like to go for, depending upon their marks and rank. rank and the availability of seats in the college, they select finally get allotted a particular college. Then they decide whether they wish to join that college or not. If they do not, then they wait, going for the second round of counseling. Even if they do not get a college of their choice, they go for the third round. And finally they have to choose the college that they get or not get a college.
And what's the infrastructure facilities that are?
Well, the infrastructure there is top class, absolutely top class. The buildings are very nice. We have one entire floor for every department in the medical college for all the preclinical subjects. It's a 10-story building, lower ground, upper ground, and then 8 floors. Every department has one floor, plenty of space, more space than NMC demands. The labs are all there, and in fact, we have additional space for more labs. Equipment is there. We have a great library, all the books that undergrads would possibly need, and more journals for although undergrads don't use journals much. Yet we'll be starting postgraduate courses this year, hopefully. We will be starting postgraduate courses this year. So journals are available, and there's online access also. So the infrastructure facilities are very good. There's a skills lab where students can go and hands-on training on manipulations before they go to the patients, because patients obviously need to be touched or treated with due respect, and they need to have some basic understanding of how to approach the patients. That training is done in the skills lab. So, yes.
And what are the academic activities that are?
Well, of course, there's a basic training for MBBS, right, which involves, in fact, the basic training right from year 1 nowadays involves hands-on training with the patients. There's supposed to be early clinical exposure, and we also have something called the family adoption program.
Okay.
The Department of Community Medicine takes these students to nearby villages which have been adopted, and there every student or a group of students is allotted a particular family, whom they are going to now follow for the next 4.5 years of the duration of MBBS. So all their health aspects are to be recorded by the students, to be taken care of by them. They are to be helped by the students to seek better health care and, of course, preventative health care. So that is one part of it. In the hospital, we bring the students the subject of physiology, especially we bring the students to the hospital and show the patients in the very first year. Right? So hands-on training is very much a part of it. Research is also another area that we are promoting. We have about 12 odd students who are putting up what is called a short-term studentship project in the Indian Council of Medical Research. And there are a number of other students who are doing or involved in ongoing research projects in the hospital, even without not being part of the ICMR thing. So funded projects which are going on, being guided by senior doctors, undergraduates are given an opportunity to get involved in those research and learn with the seniors on how to do research, especially clinical research.
And what about the faculty?
Faculties again, I think we could have asked for better. We have faculty, most of our faculty is either from All India Institute of Medical Sciences, Delhi, or the PGI Chandigarh, or SGPGI Lucknow, and of course, there's a number of faculty here, interestingly, from the Armed Forces Medical College, ex-Army, ex-Armed Forces Medical College. I happen to be one of them, so I can't forget that. And other top colleges of Delhi. So, our faculty is absolutely top class. I think on that count, we can be 200% sure.
And what about the hostel facility?
But the hostel is very nice. I would say that. All the rooms are air conditioned. That's very nice thing. They get very wholesome, healthy food. That's good. Of course, they want all sorts of junk food, but which we don't provide. But then that's okay. That's a process of getting used to living in a hostel. Even when I went to hostel, I remember the first thing was you didn't like the food, then gradually you fall in love with it. I think you start missing the hostel food once you pass out of hostel. Okay, so I think the food is pretty good. A gym is being developed. The students have a nice field where they can play football, they play cricket, and we had an annual sports day We had a annual cultural festival. It was internal only for the first year students, because that's all we have right now. So all in all, the hostel is nice and it's being developed, it's being further developed. I'm sure very soon it will be one of the best hostels across the country.
What will be the capacity?
The junior, so there are two hostels. The junior hostel, so separate for boys and separate for girls. So there's a girls' junior hostel and senior hostel, boys' junior hostel and senior hostel. The boys' junior hostel has space for 96 people, similar to the girls' junior hostel. And the boys' senior hostel has, honestly, it's under construction right now. We've completed about the first 4 floors. Entire building is complete, but 4 floors have been furnished. Finally, when it's done, it will have a capacity between the two hostels, all the hostels put together, of about 800 to 1,000 people. So that'll be nice. I'll have my hands more than full being the chief warden. So with the 150 that we have, that's already a handful. I wonder how it will be like when we have almost 1,000 people.
So these days, communication skills is an important aspect.
Oh yes. Yeah, so that is an important thing. Doctors being at the first responders or the first people in contact, healthcare people in contact with patients, need to have great communication skills. And especially since they work in such a stressful environment, they need to learn how to keep their skills intact through thick and thin. And the NMC is also emphasizing this. There's something called the ADCOM module. So students are to be taught. But in our times, it was expected that students who came would have the right attitude and communication skills. No longer so. Now we also teach them communication skills. So there are multiple ways we do it. We do it during the practical classes. One, of course, is by exam. We conduct classes well. The faculty at all times conducts itself well. So that's what the students pick up. We know that the youngsters always pick up what they see around them rather than what they are doing. So we conduct classes properly. All the doctors in the hospital, we dress well, we talk well. That's number one. Number two, we have classes for them. And more than classes, we have sessions, role play, skits, etc. Where the students themselves are given topics on which to put up skits, on how communication skills are important. So it involves it. And it's not a one-way process. And they do respond very well. And additionally, when they're brought to the hospital for clinical contact, the early clinical exposure, obviously in the first year we do not allow them to touch the patient. So they watch how the doctor behaves to the patient, talks to them, and that's how they learn. First year is just watching. It's just watching. Right? And second year also, they will do a lot of watching. The touching will come later. Right? So that's it. Yes, it's an organized process now, and I think the results are.
So why would student choose Amrita for MBBS?
Why would a student not choose Amrita for MBBS? Let's put it that way. So I guess what does a student do when he wants to be a doctor? If I'm not mistaken, what a student looks to is now a good place to be. What's a good place? A place where I have people who are intellectually stimulating, where I have an emotionally satisfying life, and where I shall learn the basic purpose of going to medical school, where I shall learn the art of medicine, science and art of medicine. So I think this is what is most important for student. Right. Parents, of course, have lots of other concerns, but the student basically wants a good place where he can enjoy himself, be comfortable, and feel safe, secure, have a bit of fun, and at the same time, become good doctors. People will be proud to call themselves doctors, and patients will come happily as they come. I think that's what every student needs. So that's what he's going to get here. Excellent living conditions. He'll have his peers who are of the same social, cultural, intellectual level. So good emotional support and talking of emotional support, yes, we nowadays also in NC insist that we have psychology department that's active, which keeps in touch with the students. We conduct screening procedures, pick out students, early signs of stress, and then they undergo due process, ease their stress and relax, and so that their adjustment initially after having left home after being in for about 19 years, is a bit of a shock. So one can understand with the added load of medical education. So a number of them might tend to get stressed out, develop anxiety. So we have a system in place for it. Right. So the student is going to be comfortable here, happy here, plenty of games, sports, extracurricular activities, good training. Okay. Excellent faculty. The lecture halls are excellent, and then the hospital. So I think you all want to belong to something good. That's always a human trait. We want to belong to something good. So I think people would love to belong to Amrita Faridabad. And a few years down the line, I'm sure our students who pass out from here will carry the word forward, and all students who come here will probably say we are from Amrita Faridabad. That's a good reason to join Amrita Faridabad.
And so, what are the job opportunities, new possible avenues for job after?
Right, yeah. So, of course, the traditional job opportunities always get absorbed in the healthcare system in India and abroad. A number of them want to go abroad, well, why not? Doctors, we make doctors for humanity. Right? But then, yes, a lot of new things are coming up. One of them is, we spoke about this earlier, research. Now, the ICMR and the Government of India is trying to promote research as a habit amongst young students also. So, the ICMR is offering a lot of fellowships for young MBBS doctors or young specialist doctors. They're giving them very good amounts of money to conduct research. So, I think that should be an exciting new field, especially because healthcare is on the brink of entering into a new, what shall we say, realm altogether. Artificial intelligence, which has been applied to so many other things, is rapidly finding applications in healthcare. Right now, we are doing image analysis, that's what application AI is doing. But it's projected that within the next couple of decades, I think AI should get big time into diagnostics. So there's a huge scope for our students to enter this crossover field of medicine and AI. Right? Because AI will need a whole lot of informed doctors who are going to, so you say, educate the AI so that then it can go forth into the world. So AI is a field that's waiting to be explored by our doctors. Young doctors who wish they could go into research, as I said. Research is something that's going to become big time in India in the near future, into developing AI. And similarly, other technologies are being applied to this, virtual reality technologies. So in Amrita Kochi, we have this cell going on, and there's this young doctor doing some great work where they build models before surgery. You build a model of the organ that you're going to operate on. So the surgeon knows beforehand, using virtual reality, what he's going to encounter as he operates. That's a fantastic tool. Right? The surgeon knows before he's cut the skin, the last 3 or 4 days he's practiced and he already knows each and every step that he's going to do, what he's going to encounter. Of course, there's always an element of uncertainty, but that gives a surgeon a huge advantage. Right? So, virtual reality. So, newer technology is being adopted in medicine. So, our students, the future I see, India's educating, training so many young people, 108,000 doctors every year. All of them, I don't think they have enough patience for all these doctors. Right? So, these young doctors are going to these alternative fields, adopting newer technologies, AI, doing a whole lot of research. I think these are the new job opportunities. Of course, enterprise has become a big thing. I find a lot of my students from other colleges where I was before coming here from FNC who started their own startups, right? Developing all sorts of apps to help track patients, to help diagnose disease earlier. So that's very nice to see youngsters using modern technology, already existing technology to help patients. Otherwise, that says it, but it needs to be said again. I'll say that especially for the young aspirants, not for the patients, not for people who come to them, but for the aspirants. Remember, you're going to get into something that is very meaningful. Not to say that other things are not meaningful, everything has its meaning, but medicine is very meaningful, and at a personal, emotional, and intellectual level, it can be deeply satisfying. Make your choice wisely. If you want to be a doctor, you're most welcome. Come to us, we'll help you achieve your dreams. But it should be very clear to you that you have chosen a profession which is going to change your life forever. And this decision means that henceforth you shall be vibrant young people doing everything that everybody else does. Yes, you'll have your bit of fun, yes, you'll do everything, but your profession demands a degree of sincerity and integrity. An immediate, or let me reframe it, say an immediate degree of sincerity and integrity that other professions might not demand all the time. Ours demands it all the time. Every patient requires the same due degree of diligence, sincerity, integrity, and you see hundreds in a day. Right? So those are some things that you should bear in mind, and these are the values that I must treasure and cherish and develop in my personality, so that I'm a good doctor someday, and everybody who knows me is proud to say that my friend, my son, my father, my husband is a doctor.
Thank you.